Dr. Linda Park here. Today we're going to talk some more about the oral microbiome. I talked about it last time and we discussed Strep mutans, the bacteria that causes decay. Today we're going to talk about some other types of bacteria that exist as well. There's a lot of bacteria in the mouth. There's a lot of bacteria in your body. There's a lot of bacteria on your skin. And as you've heard before, there's good bacteria and bad bacteria. And I feel like in this day and age that we live in, probably because of COVID that happened 3 years ago and changed all of our lives, we've become hypersensitive to bacteria and bugs and viruses and all those things. And while it's important to be concerned about that, there's certain ones that we have to hone in on. We like good bacteria. That's why there are probiotics. We don't like bad bacteria. And so there are some things that happen in the mouth that can cause bad bacteria. What's problematic about a bad bacteria? So we'll talk about that too. So some bacteria that other than Strep mutans that we can be concerned about are P. gingivalis, another one called Treponema dentacalis, another one Prevotella intermedia. Those are all big, long names, but what they all do is cause periodontal disease or exist when you have periodontal disease. Not only is it a problem for periodontal disease, but it can also be found in the brains of people with dementia and Alzheimer's disease. So we, here at Park Dental Wellness, we consider ourselves oral disease detectives, because we're looking at all kinds of things like that in the mouth. Sometimes we do bacterial testing to find out which bacteria you have that are causing problems. Sometimes we can just tell that, oh, there's a big layer of plaque on your teeth. Why is that? I brush my teeth every day. Why isn't that coming off? I've talked about that in previous videos where that causes the plaque to get hard and you can't brush it off if your mouth is open. So anyways, we love good bacteria. We don't like bad bacteria. So by having your mouth checked regularly and tested regularly, knowing what's in your mouth can help reduce inflammation. Because these bacteria, not only do they cause your gums to be red, that's actually a sign of inflammation. And inflammation is really the problem. Inflammation in itself is actually a good thing, because when you, let's say, cut your finger, it starts this inflammatory cascade, it's called, and that cascade is actually good. It causes it to be red, but it's rushing in all of these called inflammatory mediators that come in and help to resolve the problem. But in this day and age, we have so much chronic inflammation, and the chronic inflammation is caused by many things, and maybe it's actually a sign of those things existing. So things like diabetes, heart disease, and again, dementia, Alzheimer's. So we really try to focus on inflammation. That's why we want you to have your teeth cleaned every 6 months. That's why we check the pocket depths in your mouth. And when we do that, if there are pockets that are greater than 1 to 3 millimeters, we know that in those pockets, bad bacteria lives. So if you have a pocket of 1 to 3 millimeters, that environment is a place for good bacteria to live. But if you start to get pockets of 4, 5, 6, 7, 8, 9, all those deeper pockets, that's where the unhealthy and bad bacteria live. And your gums have blood vessels in them. And those blood vessels travel all throughout your body to your heart, to your brain, to your toe, all over the place. And the bacteria that lives in your mouth also lives in the rest of your body. So that's why we're so careful to check for those things and know what's actually living in your mouth. There's a cardiologist in Tennessee. His name is Bradley Bale. He's an MD. And if somebody walks in his office and needs a root canal or has inflamed gums, he sends them right to their dentist, because he knows that inflamed gums and the bacteria that live up above a tooth that needs a root canal, double the risk of heart attack. And Dr. Dale Bredesen, who is a specialist in Alzheimer's and dementia, says that those same bacteria increase the risk for cognitive decline and Alzheimer's. So it's so important to know what's going on in your mouth. That's why we stress it so much. So there are some causes of chronic inflammation. And we've heard this, by so many sources in the past. I'll just review them. Obesity is one of them. That's a chronically inflamed state in your body. Stress definitely causes inflammation. Poor diet causes inflammation. Lack of exercise. Something called insulin resistance. That condition is a pre-diabetic state. And of course, diabetes causes inflammation. Periodontal disease causes inflammation, is a disease of inflammation, as does mouth breathing. So mouth breathing is a visible sign. We'll talk about that later, and I've talked about it so much before. Mouth breathing increases the inflammation in the mouth because the mouth dries out, and it isn't meant to be that way. Mouth breathing also changes the exchange of oxygen and carbon dioxide in your blood and in your muscles. And when that happens, inflammation is set up all throughout your body because there's no nitric oxide that's happening. Another bug we look for in the mouth is Candida. Candida is a fungus, and it can also inflame things. It can make the gum tissue very red. It can also make you really sick. It's basically a yeast infection, and a lot of people think of yeast infections in other locations in the body, and it doesn't even have to be a really bad yeast infection, but just overgrowth of that fungus, which is caused by really antibiotics, because antibiotics kill both the good and the bad bacteria. And when all those good bugs are killed, fungus overgrows. And when fungus overgrows, we have problems. So we can have increased inflammation, and Candida shows up in the brain of Alzheimer's patients as well. It causes an acidic environment, too acidic for the body to be healthy. So that's another thing that we look for in the mouth is Candida, because of all the havoc that it can wreak in various areas of the body. Another cause of chronic inflammation is mouth breathing. And I've talked so much about mouth breathing and the importance of nasal breathing, and that's why I continue to talk about the importance of nasal breathing, because it gives you the correct exchange of oxygen and carbon dioxide in your body. If you breathe in through your nose, you warm up the air, you humidify it, and it distributes the right amount of oxygen to your body. And then you let out the correct amount of carbon dioxide. If you mouth breathe, you take in too much oxygen and you release too much carbon dioxide. Well, what does that do for you? When you release too much carbon dioxide, it doesn't get to sit in your blood and by your muscles and allow the correct exchange of oxygen, because there's an exchange of oxygen and carbon dioxide that takes place in the lungs, the very tiny vessels of the lungs, and gets distributed to the rest of your body. And if you're releasing too much carbon dioxide, you don't get the right amount of oxygen. Does that make sense? So that's important to nasal breathe, because you're designed, and God designed us to have your nose be the meter for all of that. The other thing that the nose does is allows sinus breathing. If you're breathing through your mouth, it's going to go from mouth down to your lungs. But if you breathe through your nose, it goes into the sinuses and then down to your lungs. And when it goes into your sinuses and it goes through the nasal passages, it produces those membranes, they're called mucous membranes, produce nitric oxide. Nitric oxide is very important for many functions in the body. One of the functions of nitric oxide is actually to help dilate the blood vessels. And when those are dilated, obviously your blood pressure goes down. And it also makes blood cells less sticky. So that's important too. So there's another important thing about nasal breathing, because if you're doing all of that, you're reducing inflammation. Your blood vessels aren't going to be as inflamed. And if your blood vessels aren't as inflamed, you're going to reduce the risk of cardiovascular disease, diabetes, all those things that I've talked about. So with nasal breathing, you're doing diaphragmatic breathing. I know I've talked about that before too. But when you do that, your breathing is slower and more controlled, and it gives better oxygenation. When it's quick mouth breathing, which is upper chest breathing, and big breaths in and big breaths out, that reduces cell oxygenation. And that's what's harmful to our bodies. Thank you so much for watching this video. I hope you found the content helpful and informative. If you did, hit the like button and subscribe for more great content.